If you're a nurse in the Philippines, you know what it's like. You are on the front lines of healthcare, day in and day out. But what if all those frustrations you face, the broken processes, the patient struggles, what if they weren't just problems? What if they were actually opportunities in disguise? Well, today we're going to break down exactly how your clinical experience is the perfect foundation for some incredible real-world innovation. Let's dive in.
Seriously, just for a second, think about your last shift. That one thing that made you shake your head, that inefficient process, that unmet patient need. What if that wasn't just another challenge to get through? What if it's a huge signpost pointing you directly to your next big idea? We are going to completely reframe those daily frustrations and turn them into fuel.
So here's our game plan for today. We're going to start by turning that frustration into innovation. Then we'll talk about your secret weapon, the nurse advantage. We'll look at 2 different paths you can take, and then we'll get super practical with how to find healthcare gaps, what kinds of solutions you can create, and finally, we'll build your action plan so you can get started right away.
Okay, first up, let's tackle that feeling of frustration head on. Because those challenging moments, the ones that make you think there has to be a better way, well, that's exactly where powerful nurse-led solutions are born. This is about changing healthcare from the inside out.
So what is nursing entrepreneurship anyway? Sounds kind of fancy, but it's really simple. It's that sweet spot where your deep clinical knowledge meets creative problem solving. This isn't some abstract business class theory, okay? It's about seeing a real problem on your shift and building a real, tangible solution for it.
And it really just boils down to 3 key things. First, you've got your clinical expertise. That's the bedrock, the non-negotiable foundation. Then you sprinkle in some innovation, which is just a creative way to fix things. And finally, you add a business mindset. And all that means is creating a solution that can actually last and maybe even grow.
Which brings me to a super important point, the nurse advantage. A lot of nurses think they need some fancy business degree to innovate, but that is a total myth. The skills you already have, the ones you use every single day, are exactly what make you a potential game changer. First, and this one is huge, you have a frontline perspective. You're not sitting in some boardroom trying to guess what patients need. You are right there. You see the system's cracks, the communication breakdowns, and the unmet needs that, honestly, most people completely miss. That is your superpower. Second, you are an expert-level problem solver. I mean, come on. Every shift demands critical thinking, making do with limited resources, and handling crises on the fly. These aren't just clinical skills, my friend. They are core entrepreneurial skills. You've basically been in business training your entire career without even realizing it. And last but not least, never ever underestimate the power of trust. Nurses are consistently one of the most trusted professions on the planet. When you launch a new service or a product, that trust is already baked in. That's an incredible asset that other entrepreneurs would spend years and a ton of money trying to build.
Okay, so you know you've got the advantage. Now let's talk about the paths you can actually take. And here's the cool part. It's not just about quitting your job and starting a company. You can create massive change right where you are.
You've basically got 2 main routes. You can be an intrapreneur, which means you innovate from inside your current hospital or clinic. The risk is lower, and you've got access to resources. Or you can be an entrepreneur, building your own thing from the ground up. That gives you total freedom and unlimited potential. Both are awesome, and both work towards the same mission, making healthcare better.
Check this out, a perfect example of entrepreneurship. So this nurse in Metro Manila, she didn't quit her job. She saw a problem, medication errors, so she created a solution within the hospital system, a simple color-coded system that cut errors by 40%. That is powerful innovation.
And here's the other side of the coin. This community health nurse saw a huge gap in care for the elderly in her area, so she started her own home care service to fill that need. Now she's not only improving lives, but also creating jobs for 15 other nurses. Incredible, right?
So whether you're leaning towards being an intrapreneur or an entrepreneur, the journey starts in the exact same place, finding a problem that's actually worth solving. So let's get down to business and talk about how to spot those opportunities that are hiding in plain sight.
From now on, I want you to think of your daily work as a gold mine for ideas. Seriously, start paying close attention. What are patients really struggling with? What are your coworkers always complaining about? What needs aren't being met in the larger community? Every single one of those complaints is a potential opportunity.
Now, once you start looking, you're going to start seeing problems everywhere, and that can feel a little overwhelming. I get it. So our next step is to give you a simple framework to organize all those ideas into clear, actionable buckets. Pretty much every solution you can think of is going to fall into one of these three categories. It's either going to be service-based, which is all about delivering care, product-based, where you create a physical thing, or technology-based, where you build a digital tool. Let's start with services. This is where you leverage our clinical skills directly. Think about starting a specialized home healthcare agency, or maybe a patient education service for newly diagnosed diabetics. The cool thing here is that they often have lower startup costs because the main asset is you and your expertise.
Next up, products. This is all about creating a physical item to solve a problem. Maybe it's an affordable, easy-to-use wound care kit for families. Or maybe it's simple health guides written in Tagalog to help with health literacy. You see what's missing every single day, so why not be the one to create it?
And finally, we have technology. And this is where your solution can scale in a massive way. Imagine a telehealth platform that connects patients in rural areas with specialists, or even a simple app that sends medication reminders in the local language. The potential here is absolutely huge.
Okay, we have covered a lot of ground, but now it is time to put this into practice. Let's bring it all home with your personal action plan to find that first big idea, and you can start literally today.
Here it is, a simple 5-step process. Starting on your very next shift, just ask yourself, what frustrates me? Look for the patterns. Is the same problem popping up over and over? Try to complete this sentence. If only we had. Then go talk to your patients and their families. Ask them what's hard. And, this is the most important part, write it all down. That notebook is about to become your idea factory.
All right, once you've got a few ideas jotted down, it's time to filter them. Ask yourself some tough questions. Is this problem something a lot of people face? Do they even know it's a problem? What are they doing right now to kind of, work around it? And then the big one. Are you actually passionate about solving this problem? Because that passion is what's going to get you through the tough days.
So here we are, right back where we started. You have the skills. You see the problems that no one else does. You have that incredible nurse advantage. So the only real question left is, what problem will you solve?